everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my main video, which is about pharmacy roles and prescriptions. Now, in the last week, I haven't done my main work for last week since there was a project I've been doing with my brother Tony for 2 weeks, so I had to pause and be absent from my group for 2 weeks, and so I have to do the pharmacy roles and prescription topic of the main work from last week again. So in this video, I'll be talking about the roles, the careers, and what are in prescriptions. Those are the three main parts in my main video. So let's get started on the first part, which is the roles of pharmacies. Well, pharmacies have three main roles. The first one is medication management and safety. The second one is public preventative health services. And the third one is accessibility and support. Now, I'll be breaking down these three main roles into smaller sections. Firstly, for the medication management and safety, we have prescription verification, which means that pharmacists check the prescription for any mistakes, any errors in it, and then check them for legality. There's safety and appropriateness before dispensing them and giving them to the patient. That is prescription verification. Next is drug interaction checks. So drug interaction checks is that they monitor for potential interactions between medications. The pharmacists measure for potential interactions between medications, food, and other substances. And that is food interaction checks. Lastly, for the medication management and safety is patient education. Now, pharmacists have the role and have the job to educate patients on crucial information of how to take the medications correctly, give them some medical advice, for example, and that includes dosage and timing for the medications, and explaining potential side effects that might come with those medications as well. So that is patient education. The next role is public preventative health services. So there are three main small parts. There is screening, immunizations, and health advice. Firstly is screening. Some pharmacists and some pharmacies around the world, this is more common in areas around the world than in Vietnam. So for the screenings, many pharmacies around the world offer screenings for conditions like high blood pressure, diabetes, and high cholesterol. So those are some screenings. That is an example of screening that pharmacies around the world may provide. Next is immunizations, which is they administer vaccines or medicines that will help the patients to be immune to a kind of pathogen or disease. And yeah, those are the immunizations. Next is health advice. Health advice is basically when you go to a pharmacy, which many of us may have gone to. We will hear our pharmacists give advice to our parents about how they should take the medication, or give them some health advice for that as well. So pharmacists can offer guidance on a range of health issues or health concerns, from managing minor ailments to lifestyle advice like avoid drinking alcohol or reducing the amount of smoking. So that is health advice. Lastly is the accessibility and support. Well, if you go on the street in Vietnam, around every 100 meters there will be a pharmacy. That is basically what my local area is basically. Every 100 meters there is a pharmacy. So pharmacies are often more accessible than a doctor's office and serve as a vital point for contact for many health needs and patients. So basically every 100 meters there will be pharmacies, and we can choose from those pharmacies to get the medicine that we need, over-the-counter drugs, things like that. Next is medication adherence. So medication adherence is that pharmacists basically play a key role in helping patients stick to their medication plans. That is for the medication adherence. Following the doctor's prescription, the doctor's advice and prescription. The pharmacist will help patients to stick to that prescription and the medication plans. That is basically for the roles that I find out. The next part is the careers. So there are three main parts in the careers. There's the types of pharmacists. I found 5 main types of pharmacists. There are community pharmacists, hospital pharmacists, clinical pharmacists, nuclear and military pharmacists. So there are many kinds of pharmacists around the world. This is a broad field, not only in clinical. It is not limited to clinical, hospital, or community pharmacists. And that is for patient care and clinical roles. The next type of career that pharmaceutical field is industry research roles. Like there can be pharmaceutical scientist or a biomedical researcher or pharmacovigilance specialist. So those are some of the common careers. Some other careers that are involved in pharmacies are compounding pharmacist, drug information pharmacist, or pharmaceutical sales representative, etc. So those are some of the careers that may be presented in the pharmaceutical field. Lastly, I want to talk about what is prescriptions, what are the components of prescriptions, and give you some examples of the layout of the prescriptions so that we know what prescriptions are. So firstly, what are the components of prescriptions? So firstly, what is a prescription? So a prescription is like a small piece of paper, an instruction from the doctor that they give to the patient, and then the patient gives to the pharmacist, and then the pharmacist will, based on that prescription, and give the patient medications based on the doctor's orders. So its dictionary meaning is an instruction written by a medical practitioner, a doctor for example, that authorizes a patient to be provided medicine or treatment. So basically that's what that's what prescriptions are. Next, I am intending to talk about the components of prescriptions. Now, some common components of prescriptions are the name of the patient, the date of birth or the age, the date of or time of order, the drug name, the amount of drugs, the frequency, the dose, the quantity of that drug, the name or signature of the prescriber or the doctor, and also the weight of the patient when appropriate, when we need weight-based medication. So that is the weight of the patient. There sometimes be drug strength or dispensing instructions. So almost all the time are dispensing instructions. So the four main parts of the prescription are subscription, inscription, and the inscription, superscription, and signature. So those 4 main parts, but here's just some of the components. So I'll explain what the subscription is. The superscription, or sometimes known as RX. The superscription, sometimes called RX. What does the RX mean? The symbol RX stands for the Latin word recipe, meaning take though, indicates the start of the prescription order. So that is the superscription. The inscription, the next part here, the inscription is the main part of the prescription, which details the drug strength, the drug name, and also the dosage form. So for example, the drug name can be a brand or a generic name. The strength, the concentration of the medication, for example, 500 milligrams. The dosage form can be in tablets, capsules, liquid, cream, solution, example. Those are some of the examples. And then the subscription. The subscription is the directions for the pharmacist from the doctor to the pharmacist on how to prepare and dispense the medication. For example, dispense 30 tablets. That is the subscription. And finally, there's the signature. The signature is the instructions for the patient, which are transferred to the medication label. This includes the quantity of the dosage to be taken, the frequency of the medication, the administration, like daily, twice per day or twice daily, the route of administration, like mouth or by the mouth topically, and special instructions like with food, shake well, and things like that. So that is the signature, or SIG. Sometimes it's called the SIG, written in that way. So I want to show you a few examples of subscriptions, and yeah, I want to give you a few examples of the prescriptions. Firstly, I have this example, as you can see here. This example is a little bit blurry, but I will manage to read it out. Firstly, there's the phone number, of course. There's the name of the patient, the name of the prescriber, this is Eva Adams, MD, and the address. Next, we have the name of the patient, the age, the date of prescription, and the address of the patient for contact purposes. As you can see, there's the RX, which is the superscription. So this is the superscription, or its meaning is recipe. There's inscription here, which is the medication prescribed. This is the name of the drug. The instructions to the pharmacist are here, and the signature, or this is the directions for the patient. So the subscription is instructions for the pharmacist, and the signature is directions for the patient. And lastly, dispense as written. There will be dispense right here. Another example of this is this type of prescription. There's the patient name, the address, the date, the age, the date, the address. There's the name of the drug, the dispense, the signature, is it generic or not, and the refill, the times, the name of the prescriber, which is the doctor. And yeah, that's basically some examples of a prescription. Lastly, I want to show you this prescription. This is a prescription that is clearer than the others. This is the types of prescriptions and the formats vary, but they have some of the components that I've talked about before. So this is for, which is the patient, John R. Doe, the medical facility. There's the date given, the subscription, the prescription, the date that given the medication, the superscription, the inscription, there's the subscription, and the signature. This is milligrams or milliliters written here. There's also the number here, and the signature, rank, and degree of the prescriber. So this is the name of the doctor and the degree as well. This is filled by who, the expiration date, and yeah, that's basically an example of a prescription. So, in conclusion, the components of the prescriptions varies, and that will depend on the types of prescriptions. So as you can see, there are various formats for prescriptions, but some of them have some of the main components, which is, of course, the name of subscriber, the subscription, the inscription, the superscription, and the signature. So remember that in mind. And that is all for my main video this week. To end this video, I have a quote. Medicine may cure, but only pharmacists can care. So this is the end of my video. I hope that you enjoy listening to this video. Or if you don't, please give me some suggestions for improvement and leave your opinions behind. Thank you for listening to my video, and I hope to see you soon. Goodbye!